some of my holiday readings. Also, I kept my eyes on the news websites, and I was looking at the Health for Mzansi website. That's about health and wellness and speaks to public health. And there was a interesting piece on the healers and who heals the healers, the impact of stress and trauma on those particularly in the public health sector, but also those whose job it is to care for others, like occupational therapists, like the trauma doctors, like the social workers. We know that in South Africa, we have 72% of South Africa's medical health professionals continuing to work despite mental health struggles. This was a survey that also was released that said that 49% of doctors continue to work because they felt that their patients depended on them. But who heals the healers? It's something to think about, the impact of the emotional and health stress on a GP, on a psychologist, on a social worker. So I'm joined today speaking to psychologist Dr. Jude Clark to find out what techniques the healers use to keep themselves in a positive state of mind. Joins me on the line. Good morning, Jude. Really appreciate your time. The survey that was conducted last year saying that 72% of South Africa's medical professionals work despite mental health struggles. Is this struggle real? Have you experienced this dependence on you and your patients, even though you yourself may be struggling physically and emotionally?
Thank you, Lester, and good morning to you and your listeners. Certainly, this issue is personal. I have been there in my circle of colleagues and friends. We often speak about this challenge of taking the impact of our work seriously. I think that's the first step. To see this labor that we do, which is often emotional labor, like physical labor, like the impact that it has on us. I have had to be very intentional around realizing that this work impacts me physically, emotionally, psychologically, even spiritually. And I have to have taken very seriously what I do about it. How do I cope with that? And I think once we give ourselves permission as healthcare workers, as mental health care workers, as people who work with healing and other people, to say that we are human and we are carrying not only the burdens of others as part of our helping profession, but that we are also living life as normal everyday humans with everyday stresses, and to take those seriously. But definitely being there myself, and appreciate seeing that we are also vulnerable to these stresses, not wanting to pretend that we are somehow above that ourselves. Yeah.
That survey conducted by the Medical Protection Society, as I said, also saying that almost half of medical health professionals saying that they feel obligated to continue working despite the physical and mental fatigue because they believe that their patients depend on them. How have you encountered that?
I think that there are gaps, Lester. I think there are cultural and social gaps that used to be filled before, in our communities, in our society, where we could lean on other systems, family systems, social support systems. And I think generally the public is under quite a lot of strain now. And so professionals do feel that obligation that if I don't do this, the patient, the person, the client is really stranded. But it's not sustainable for me to really internalize that, to say I have to work round the clock because if I don't do it, the system is going to collapse or the person is really not going to cope. I think we need to be putting our energies into thinking a little bit more creatively about how to shift some of the social systems and structures that are leaving our communities and the public without fuller support, I think. But we can't do it ourselves.
You're quoted in this article on Health for Mzansi that the post-COVID online work has also impacted on your personal health. You would have regular consulting hours, which would usually be business hours. But because of greater online connectivity, you're finding yourself having to deal with patients, calls, even after hours. So a post-COVID world, which we thought would make things easier, particularly online, has actually increased your burden of work. That's that emotional labor that you talk about of.
Absolutely. I think in terms of quantity and the intensity of the work. So, like 3 years, COVID and post COVID have been such heavy work around grief, around mourning, around stress. There's been so much loss, even economic loss, but so many stressors. So the intensity of the work and what people have brought to therapy or brought to the healthcare professions has been just overwhelming compared to pre-COVID years. But yes, what online work has done is it's also made the work a little bit more accessible in terms of region. So perhaps in-person consultation, only people who were in my community would travel to see me. But the demand now becomes national, becomes global, with people saying, can I consult? And so suddenly the day becomes a 16-hour day possibly. And it's my responsibility to know what is my capacity and how do I contain the work I do so that I stay healthy and resourced to be of value to others and to not just burn out.
Is there professional support, whether it be in the private public sector? Is there professional support in the associations of medical and healthcare professionals to say, if you are feeling stressed, if you are feeling the burnout, if you are, like yourself, have experienced the 16-hour call days, that there are channels to reach out to?
There certainly are. I think they need to be made more accessible and I think supported more in terms of permission to say it's okay that you're not okay, even though you're a surgeon, even though you're a therapist, even though you're a occupational health provider, that you are human and you need support. There's peer support. Many of our associations strongly encourage supervision so that you do get that professional support if you are struggling and your own personal therapy. But I think peer support, supervision, debrief, those systems are there, but I think they can be promoted more. Once, Lester, I was a few years ago offering free services to nurses who were really struggling before COVID around compassion fatigue and stress and how it impacted how they showed up at work. And the collective of just the one health institution I approached said that they are too busy and too tired, which is that tension, right? They're too busy and too tired to engage how to deal with the busyness and the fatigue. So yeah, oftentimes, the response is, I don't even have time for that. That's a luxury for me to seek the support. And we need to think of ways around that, I believe. Many of us are really working on minimal resources, personal energy resources, and we're not doing our best work.
That concept of compassion fatigue, and we've spoken about this in great deal last year when people have contacted us about their concerns of the level of care, the level of professionalism shown by nurses, doctors, therapists in the public health sector. And then we got plenty of calls from doctors, from nurses saying, it's simply because we're overburdened. Of course we care for our patients, but this concept of compassion fatigue, there's only so much of myself that I can deliver to provide a personalized level of care for a patient. At the end of the day, that jug, if we use the analogy of a beak of water, I am dipping out every single day a little bit about myself, of myself, and sooner or later that beak of myself is going to be empty, Jude.
Yeah, absolutely. And so we have to take that refilling seriously, and there needs to be resources for that. I also would, prefer if it wasn't my personal responsibility as a nurse or any kind of health care provider to keep resourced, working such long hours. If I had further support, from my associations, from the state, and to do that. But yeah, I think also, Lester, that there's so much despair out there. I mean, for me, over the last few years, it's been really hard work to not become cynical and despairing and to keep my heart open, even as, simplistic as that sounds. Um, when what you see is despair and despairing every day, just the levels of violence, of different kinds of violence, and the difficulty of seeing solutions, so that holding on to hope, it does become quite a challenge. But that in itself is a resource that keeps us caring. So I also think our work is around activism, that we're not just waiting to heal problems, that we're changing the things that lead to these levels of violence and these levels of despair and socioeconomic hardship that lead to such stress and strain. But yeah, compassion fatigue, deep. I mean, you just start caring less, is my most simplest description.
I'll leave with this message, Dr. Jude Clark. Thanks, Esther, for the great topic, important topic. But a relative of mine died last year because of suicide, accidental overdose, was a GP, was community orientated, but the level of mental stress broke her. And I think that's an very important concept and message to keep in mind this upcoming year, 2025 and beyond. Dr. Jude Clark, really appreciate your time.